Good afternoon, all. Am I audible? And can you see the screen? Please reply in the chat box. Okay. So today's topic will be carbohydrates and dietary fiber. It's in your nutrition textbook, page number 26. Okay. There are two chapters on carbohydrates. The first chapter is part one, carbohydrates. The second chapter is dietary fiber, part two. Both we will just brush up today. Am I audible to all? Yeah. So page number 26, please make a note of all the important tables and important paragraphs I may ask you to mark in your textbook. Those students who have not received the textbook, you can make a note in a paper and later you can just translate that information when you get the uh, textbook. Or you can contact me also. I can re-guide you regarding the important topics and important page numbers. So it will be easier for you to understand what you have to study from exams point of view. And we will not be going into too much of technical details. Just we will make sure that you are clear in the concepts of these two topics. The concepts are clear. You can understand the meaning. If you want to get too technical, you can do that during your self-study sessions. And in case of any doubt, you can surely reach out to me or either Dr. Pawan Mittal. So carbohydrates. Carbohydrates are basically, they are just sugar molecules, okay? They are free sugars. So why do you require carbohydrates? You require carbohydrates because your body requires glucose to do various of functions in terms of energy. So carbohydrates will be hydrolyzed, means there will be hydrolysis for the students who do not have a good in-depth knowledge about science. In hydrolysis is a process in which a water molecule, a single water molecule, that is H2O, water molecule will be able to break down any complex compounds, either or complex compound bonds and everything. Okay, so it's a bit of chemistry into this. So just remember this: carbohydrates will be broken down into glucose, and this glucose will further give you energy for your cells tissues to continue with their various functions. So glucose or blood sugar, it is the main source of energy for your body's cells, tissues and organs. So we can make a statement here that carbohydrates are the main source of energy from your diet. Okay, so whatever your diet plan is, a large 50 to 60% of the energy should come from carbohydrates. Okay, so we have complex and simple carbs. We will discuss about it later. So I guess the basic meaning of carbohydrates is clear for you. Next, we have classification of carbohydrates. It's given in page number 26. Uh, and the different types of carbohydrates under each of this classification with certain examples how their chemistry is. Do not get into the chemistry part or the skeleton structure or how the bonds are formed. You don't have to learn about that. You can just understand the names, the subgroups and the types of carbohydrates. That's it. And the different components of carbohydrates under these subgroups. So if you want to take a picture or a screenshot of this particular slide, you can take it. The content are very much same of what it is given in the textbook. Okay, so for learning purpose, or at least you can make this same table in your notebook or somewhere, so you can remember things in their subgroup or components. Okay, you just take a screenshot of this particular slide. The contents are same of what is given in paragraphs in your textbook. I have just put it in the tabular format. So sugars, we have different types of sugars, that is monosaccharides, disaccharides, and polyols. Can anyone from the previous class, those who have attended, does anyone remember the term polyol? Under which subject did we, under which topic did we discuss about polyols? If anyone remembers the previous class, anyone in the chat box, we can just write one small topic name under which we discussed about polyols and everything. Nobody remembers the previous class? Anyone? Polyols came under the topic of discussion under artificial sweeteners. Remember the examples we just read about sorbitol, mannitol, and all. So please do not forget what we take in the classes. If at all you are making notes, okay. So when you see certain things, when it is repeated, means high chance of that question coming in the exam. Okay. So in sugars, you have monosaccharides, disaccharides, and polyols. From the name itself, we can understand in monosaccharides there is just one bond of glucose. In disaccharides, there are two bonds of glucoses, and so on. In polyols, again. So in oligosaccharides, they are uh, short chain carbohydrates. Then we have polysaccharides, we have starch, non-starch polysaccharides under this. Just understand and remember which kind of components will come under which subgroup. Do not intermix these things. So we may ask you some examples. We can list out few examples and we may ask under which subgroup or under which component of carbohydrates is you will find these components. Okay, so for example, we may give sucrose, lactose, trehalose, or whatever examples is given in the textbook. Okay, these components will come under which class of carbohydrates. So you should understand it comes under the free sugars or disaccharides. So like that, you have to understand these tables. That's why I asked you to take a screenshot of this. Next, we have functions of carbohydrates. So there is a lot of explanation given about monosaccharides and everything. You just have to read through it. But for exam point of view, the name of these components is more important. Just read through it to understand these things more. Functions. The first main function of a carbohydrates is it's the most commonly used source of energy within the body. When body goes into a deficient stage of carbohydrates, is when you're having a carbohydrate deficient diet and all, then the body will go to protein and fats for its energy source. Otherwise, carbohydrates are the main sources of energy through diet. Protein sparing action. So again, what happens here is the energy requirement is fulfilled by carbohydrates, whereas the body will keep the protein for muscle building and tissue building action. So protein is paired in such a way that it doesn't have to provide energy, it just have to focus on bodybuilding, muscle building, and tissue building function of the protein, while the energy requirement, the carbohydrates can take care of it. So that is why we call it a protein sparing action. Then we have oxidation of fats. Remember here, underline the under oxidation of fats. Those who have the textbook, please underline acetyl-CoA. Okay, acetyl coenzyme A. So acetyl coenzyme A is required for energy production through various cycles. There are various cycles called citric acid cycles and all. So how you will get acetyl-CoA? You will get acetyl-CoA when carbohydrates and fatty acids will react, and oxaloacetic acid from carbohydrates will react with the fatty acids, and then acetyl-CoA will be produced, and this acetyl-CoA will be further used for various other cycles, which will give energy and other outputs and other derivatives, which will lead to other functions of the body. So that is the oxidation of fats. So carbohydrates will help in the oxidation of fat, so that acetyl-CoA enzymes are released for further utilization of and further energy production cycles. Then we have indispensability of nervous system. So always remember, for the a good functioning of your brain tissues and central nervous system cells, you require a diet which has a good amount of carbohydrates, not too much, not in excess, but in a balanced form. If the body is not able to get, if the body goes into a state of hypoglycemia, means when your blood glucose level is very low, it will really damage it may cause an irreversible damage to the brain cells. Okay, so that is how carbohydrates is important for the apt functioning of your central nervous system. Role in muscles, glycogen. It is glycogen comes after breaking down the breaking down the glucose. It is converted into glycogen, and it is stored in the liver and in the muscles. So in the glycogen which is stored in the liver, that will be again converted into glucose when the body goes into a deficient state. But the glycogen which is stored in the muscle, it is used for giving energy to the muscles during its contraction and relaxation. Whenever the muscle requires more energy, whenever you are doing a very cardio type exercise, or you are doing too much of physical activity, your muscles may require too much of energy, and the glycogen which is stored in the muscles will break down into lactic acid, and during the contraction and during the recovery period and during the relaxation period, this lactic acid will again get oxidized into acetyl-CoA and pyruvic acid. Acetyl-CoA, again it will go into the citric acid cycle to give more energy, and so on. So remember this thing, for it has carbohydrates has a role in giving energy to the muscles to do its contraction and relaxation function properly. Then we have a role in liver. As told earlier, it is stored in the form of glycogen in liver, and whenever there is a diminished supply of carbohydrates, the glycogen which is stored in the liver will be converted into glucose, so that the body can meet its energy requirement. And it also helps the liver to do its detoxifying action and regulating the influence of protein and fat metabolism. Energy for the heart muscles. So heart muscle also will exclusively use glucose as the main source of energy. So in state of, again, if you go in a state of hypoglycemia, it will have an adverse effect on the heart muscle. Synthesis of ribonucleic acid, that is RNA. You can also say that carbohydrates is required for the synthesis of RNA. Conversion to fat. So whenever you are having excess calories in diet, like excess amount of carbohydrates, if you're ingesting too much of carbohydrates, this extra amount of carbohydrates, it will be stored as fat in your adipose tissue. Adipose cells are the fat storing cells in your body. Okay, so these carbohydrates will be converted into fat, and it will be stored in the adipose tissue. And when the body goes into a deficient state of carbohydrates or any other proteins or source, or any if it goes into a fasting state and all, so from adipose tissue, this fat will be utilized to again provide energy. So there are various storages like liver, muscle, and various adipose tissues there, where body has a good amount of storage of converted carbohydrates, so that in case of any extreme fasting situation or an extreme diet or anything, your body is able to maintain its normal blood glucose level or anything through these fat storages. which is provided in the body itself. Then there is a function for the growth of desirable bacteria, especially lactose. Lactose, again, it's a form of free sugar. So lactose has several functions in the gastrointestinal tract, GI tract. It promotes the growth of desirable bacteria for gut health, and it also enhances the absorption of calcium. It helps for calcium absorption. Then we have dietary fiber. We will discuss in detail about dietary fiber in the next session. So a small amount of energy, not fibers usually do not give much of energy, but a very small amount of energy, especially when you are ingesting fermented fibers. There are two types in general, fermented and non-fermentable fibers. So if you are having fermentable fibers, you may get a small source of small amount of energy through that. And usually it is dietary fiber is taken for gut health and a good peristaltic movement for your intestines. Then for biosynthesis of amino acid, the carbon skeleton which the carbohydrates have, you must have seen that the CHO branches and all those things. Those who do not have a good knowledge from the science background, it's just the chemical compound and the chemical structure of the carbohydrates that will help in the synthesis of amino acids. So that amino acids are the broken down form of the proteins. So what happens is that you have simple compounds present in the form of amino acids in the body. So it can be in the form of biosynthesis, means within the living organism, using various enzymes and using various compounds, you can make protein and convert it into any muscle building or a tissue building, put that into that criteria of function. Then you have structural component. So carbohydrates are the precursors for many organic compound. For example, glycolipids, glycoproteins, etc. If you want to for cell growth, fertilization, etc. For all these things to take place, carbohydrates is in presence of carbohydrates only. These cycles will lead, and it will lead to cell growth, fertilization, and other cell functions and everything. So you require carbohydrates for its for other cycles to keep on going. Then we have digestion. Again, a similar table to this is given in page number 32. Just mark that table 3.3. Make sure you learn that particular table, so it's easier for you. So digestion here means how the from where the digestion starts, from where the breakdown of the carbohydrates starts. First, it will start in the mouth itself. When you eat the food, carbohydrate rich food, when it gets mixed with your saliva, not all the starch is digested in the mouth. A very few amount of starch the digestion process will start, and it is because of these enzymes amylase and ptyalin. So you can underline amylase. Ptyalin is not given, I guess. Yeah, so, you can underline amylase if you have textbook. And starch is the carbohydrate which amylase will break down, and it will the final product will be maltose. Then when this partially digested food, it reaches your stomach because of the digestive juices and the enzymes secreted by pancreas, amylase and amylopsin. Again, the starch will convert into maltose. And then again, this chyme is the undigested food along with the gastric juices. Okay, so that when it enters your small intestine, your intestinal glands will secrete maltase, sucrase, and lactase. Maltase will break down maltose, the maltose which we got from starch. This maltose will be further broken down into glucose. Sucrose will be further broken down into glucose and fructose. Lactase will break down lactose, and further it will be that the final products will be glucose and galactose. So understand this table. It is given in a very simple form in your textbook, page number 32, table 3.3. That's important. Please mark that. Then coming to absorption. Um, in absorption, there are glycemic index and glycemic load is given, which I have took in the previous class. So please go through that. Okay, those who have not attended previous class, don't worry. After 1 month, these classes will be repeated. All the classes will be repeated. So I have explained glycemic index and glycemic load in the previous class. Even in the previous chapters, it is given. Please read it, please be thorough about the difference between glycemic index and glycemic load. Glycemic load will give the overall glycemic index of the entire diet, but glycemic index will give you the rate in which the blood glucose level will increase for a particular food. Okay, for the entire diet, glycemic index cannot give the answer. It will just rank the food according to the highest glycemic index score foods to the lowest. Okay, you can just rank your foods according to them, but the glycemic load of the entire diet of a particular community, okay, that can be understood only by the formula of glycemic load. So please be thorough with that. So under absorption, there are mainly three types of absorption through which now you have broken down the, in the previous slide you have seen we have maltose, we have glucose, fructose and galactose. Okay, so these are the digested products, okay, in the small intestine. Now how will these products travel into the bloodstream, or how they will reach the cells to give energy, and how they will further go on from here. Okay, they have reached the small intestine. From now, from the small intestine, where to and how. So that is where this absorption part will come into play. In the textbook it is given. Okay, main thing you have to remember here is passive diffusion, facilitated diffusion and active transport. So I will explain these three things in brief. So some forms of carbohydrates, the simple sugars, no, just because of the osmotic pressure, from high concentration to low concentration, they will be directly absorbed by the small intestine. Just imagine this is the villi of the small intestine, which will help in absorbing the nutrients. Okay, so from higher concentration to lower concentration, directly it will get absorbed into the small intestine. From the small intestine, it will reach your bloodstream and everything. Okay, so that is passive diffusion, simple. And in facilitated diffusion, what happens is that there are protein carriers situated in the small intestine linings. Okay, protein carriers. These protein carriers will help the glucose, fructose, and all to pass through the membrane. Okay, this big round which you can see in lavender color, light purple color. Okay, so this consider this as the protein carriers which will allow the broken down carbohydrates to pass from the extracellular, from the small intestine lumen into the uh, membrane of the small intestine, and from there it will carry on its function of further breaking down and providing energy. Okay, so that is facilitated diffusion or carrier mediated diffusion. Okay, next we have active transport. So here for example, sodium comes into play. I guess you all know uh, what is sodium. Okay, when your diet has enough amount of sodium, so glucose and sodium has a very similar passage to get absorbed. So what happens here is, the students who are not from the science background, just remember this thing: sodium will drag the glucose along with it while getting absorbed. So that is the way how glucose will get absorbed along with sodium. Okay, so if when sodium has to go inside, potassium should be coming outside. There is an exchange taking place. So there should be a sodium potassium balance should be maintained in the body. That's the reason. So the cell membrane of the intestinal lumen and all, it will give out potassium, and it will take in the sodium, and along with the sodium will drag the glucose along with it into the small intestine, and from there it will carry out its cycle of giving energy and increasing the blood glucose level and all those things. Okay, so that is active transport. So this is the main three things you have to understand. What is passive diffusion? Directly it will get absorbed. It doesn't require any carrier, or it doesn't require any other ions or compounds to help it out. Directly it will be absorbed. In passive, in facilitated carrier mediated transportation, diffusion, you require a protein carrier which is already present in the intestinal lumen to enter into to help the glucose and other forms of carbohydrates to enter into the small intestine, to be absorbed by the small intestine. In an active transport, sodium will drive the glucose along with it. So that's the three main difference about passive diffusion. These three mechanisms, you just have to understand the concept. If the slide was clear, when you read the paragraphs which are given on page number 33, it will be much easier for you. If this concept is clear, it will be much easier for you. Then later you can do the self-study for factors affecting absorption. It is a bit technical and all, but those who want to enhance further knowledge in that area, you can read that. Otherwise, it's not that important, but for your practice or your personal knowledge, you can go through that. So, but please be clear about these three absorption value, because now you should understand how important sodium is in terms of absorption of glucose. Now, once we have absorbed our carbohydrates, now how the body is going to break it down, that is metabolism. So we have direct utilization. For example, glucose, it is directly utilized by all the tissues and cells of the body, and glucose will directly give them the energy. Glucose should be made accessible to all the cells of the body as a major source of energy. Okay, certain cells, especially the nerve cells, the brain tissues, they cannot function without the availability of glucose from carbohydrate. So that's the direct utilization. Completely the entirety of, excuse me. Yeah. So in direct utilization, glucose will be completely utilized for the functioning, but for the well functioning of the cells and tissues of your body, especially for the nerve cells and the brain cells. Then we have conversion of glycogen. What happens here is, if you are having excess of carbohydrates, or in your diet there was a bit of excess of carbohydrates, uh, the excess of the glucose will be converted into glycogen, and it will be stored in your muscles and in the liver. Okay, so the body only stores a very limited amount of glycogen. The liver glycogen stores are quickly converted into glucose to be used for energy. The muscle glycogen, however, it is used only to supply the muscle with energy via glucose. Okay, the glycogen which is stored by the muscle is not going to share it with anyone else. But the glycogen which is stored by the liver, whenever the body or any certain organs, it will go into decreased state of glucose, or goes into the hypoglycemic state. The entire body, when it goes to the hypoglycemic state, the liver will uh, make sure the glycogen is broken down. Glyconeogenesis is the synthesis process. Okay, the name is given. If you want to remember it, you can remember it. Through glyconeogenesis, this glycogen will again be converted back into glucose so that the body can utilize it for its energy requirements. So liver has glycogen stores only for 12 to 18 hours of fasting. After that, the liver becomes glycogen depleted. Okay, so you can underline that line. It's on page number 39, third paragraph, last line. The liver has glycogen stores only for 12 to 18 hours of fasting. After that, it becomes depleted. Then the final stage of metabolism here is it will be converted into fat. The steady excess intake of carbohydrates through diet, what will happen is there is an excess amount of carbohydrates. Now the body has to convert this excess amount of carbohydrates into fat, and it will be stored in the adipose tissue of the body. As told earlier, adipose tissues or the adipose cells are the fat storing cells in the body. So they will store the excessively converted carbohydrates into fat, and they will store that fat in the body for future requirements. So I hope these three areas is cleared. Just remember these three headings: direct utilization, conversion to glycogen, and conversion to fat. In direct utilization, the glucose will be completely utilized by the tissues and cells of the body, especially the nerve cells in brain, etc., for its energy requirements. Then we have maintenance of blood glucose levels. So in fasting, 80 to 100 mg per deciliter should be a normal range for the fasting blood sugar levels. Sometimes the range may differ from laboratory to laboratory. So in our textbook, it is given this is the range. So for exam purpose, please try to remember this particular range. In postprandial, after food, 130 to 140 mg per deciliter will be the increase in blood sugar, normal increase in blood sugar within 1 hour. As soon as you have had food within 1 hour, this would be your blood sugar level normally should be around this range. After 1 hour, within 2 hours, it will return to the fasting level. So this is how a normal blood sugar level will vary as soon as you have food and how it comes down. So these values may differ from laboratories and from hospitals range and all, but for exam purpose, I'm repeating, please follow the range which is given in your textbook. Then we have rapidly available glucose. A small box is given about that. So it is the sum of the free glucose or glucose from sucrose, everything which is available for rapid digestion. Okay, the rapidly available starch and all. How rapidly the body can convert this into convert this glucose, which is free sugars, which is available. How rapidly it can convert for its energy requirement, the amount of that glucose per gram of food eaten. Okay, per gram of food eaten in every gram of rice which you are having, in any every gram of chapati or any kind of food which you are having, in every 100 grams, how much of the sugars are there, how much of the rapidly available starch are there, and how much of the slowly available starch. Okay, there are two types of starches. One is rapidly available, it will be absorbed and metabolized easily, it will spike your blood sugar level very soon. And there's another kind of starch which will be slowly digested and slowly absorbed. It will not spike the blood sugar level too soon as compared to the RTS starches. So rapidly available glucose values will give the amount of glucose from 100 gram, how many gram of glucose is available for rapidly digestion, and how many grams of glucose is available for slow digestion. So that is a value. A table and everything is there, but in textbook a small paragraph is given. Just go through that. That is enough. Then we have hormonal control of blood glucose level. Certain hormones are secreted in our body, and their effects on blood glucose level. So insulin and somatostatin are the two hormones that will decrease the blood glucose level. In textbook, they have mentioned only about insulin. So yeah, insulin will decrease the blood glucose level. It is secreted by the beta cells of the islets of Langerhans in pancreas. Pancreas has two types of cells, beta cells and alpha cells. Okay, so beta cells will secrete insulin, alpha cells will secrete glucagon. Just read about these things in the textbook. It is very easy, you will understand it. Okay, so insulin will decrease the blood glucose level through the process of glycogenesis, like the glucose which is stored as glycogen in the liver and in a muscle cell. So what happens is, as soon as you have food, the blood glucose level will increase. Okay, so what happens is, when the insulin is secreted, the insulin will direct the liver and the muscles to completely take the blood glucose level, convert it into glycogen, and store it in the muscles and liver, so that automatically the blood glucose level will come down, because it is being converted into glycogen and it is stored everywhere. Okay, that's how it functions. That's the mechanism of action of insulin. In somatostatin, it is not given in the textbook, so don't worry about that. So what's given in the textbook, only be thorough in that areas. Next, we have glucagon. It is produced by the alpha cells of the islets of Langerhans, and it has the effect exactly opposite to insulin. So what happens is, now the glycogen is stored in liver and in the muscle. So what glucagon does is, here it will direct the liver to take out the glycogen, convert it into glucose, and release it in the bloodstream. Okay, it's just the opposite of what the insulin did. Then we have epinephrine. It is secreted by the adrenal glands, the medulla section of the adrenal glands. Then it will favor the breakdown of liver and muscle glycogen, again to increase the blood glucose level, same like glucagon. Then we have glucocorticoids. Cortisol and the adrenocorticotropic hormone, that is ACTH, which is mentioned here, cortisol and ACTH, consider them under the glucocorticoid section. Okay, so these are the steroid hormones that elaborated by the adrenal cortex. Now it is secreted by the adrenal cortex part of the adrenal gland. So it is also influence the blood glucose level by stimulating gluconeogenesis. Remember the difference between glucogenesis and gluconeogenesis. Okay, in gluconeogenesis means neo means new. Okay, from glycogen, glycogen will be converted into glucose for increasing the blood sugar level and for utilizing the increased blood glucose by the cells and tissues. Thyroxine is a thyroid hormone. Severe lowering of the blood glucose concentration increases the thyroxine secretion. As well as your body goes into a state of hypoglycemia, your thyroid gland will secrete more of thyroxine. What thyroxine will do is, it will help this epinephrine hormone. Thyroxine will help the epinephrine. What epinephrine does is same like what the mechanism of action is same of that of glucagon. It will guide the liver to take out its glycogen stores, convert it into glucose. So thyroxine will help epinephrine. Then we have growth hormone secreted by the anterior pituitary gland. It raises the blood glucose level by increasing the amino acid uptake and protein synthesis by all the cells. So what happens is, cells require energy. Okay, so now the growth hormone will guide the cells to take protein and fat into consideration for their energy requirement, so that they leave alone the blood glucose. So in that way, blood glucose levels are maintained. At the same time, the cells will be using amino acids and the breakdown of fats for their energy requirements. They will not interfere with the glucose for their energy requirements. So that is how growth hormone will help. So these are the hormonal control of blood glucose levels. Just go through the paragraphs, you will understand it. If you have any further doubts, please do let me know. Then we have RDA for carbohydrates. The RDA numbers which is given in the textbook by ICMR, please follow that. So the main takeaway point here is, especially in adult diet of an adult, 60% of the total calories should come from carbohydrates. In a balanced diet for an adult, 60% of the total calories should come from carbohydrates. So usually we take a 2000 calorie diet as a presentation value. So in that case, 275 to 300 gram of carbohydrates is recommended, and only 10% should be from sugar. From this 60%, only 10% should be from sugar. Remaining should come from complex carbohydrate. Sugar is a simple carbohydrate, easily absorbed, easily metabolized. It will spike the blood glucose level. Complex carbohydrate will take time to be broken down, to be absorbed and metabolized. So it will only slowly increase the blood glucose level. So most of the carbohydrate should be complex carbohydrate, and only 10% or even less than that should be from sugars. Sources, please refer the page 44. A table is given. Various sources of carbohydrates, usually found in the Indian cuisine, and were stapled to the country. Okay, so whatever the sources are mentioned here, you can refer this particular table to help out your clients also in your consultations and all. Any doubt so far? Any doubt, then please put it in the chat box if you have any doubt. If no, then we can continue with dietary fiber part of the class. So protein sparing function means, as told earlier, carbohydrate is considered as the main source of energy. There is a reason why, because if your diet is not rich in carbohydrate, okay, if your diet is deficient in carbohydrate, your body will turn to fats and proteins for its energy requirements, because body requires energy, right? Each and every cell in your body requires energy for its optimal function. Okay, so if you are not giving your body enough carbohydrates, what the body will do, it will take up the protein and fat for its energy requirement, and these proteins and fats have other functions also, and those functions will be interrupted because of the deficiency of proteins and fats. To overcome this, we always say most of the energy should be supplied by the carbohydrates in your diet, so that the proteins and the fats are left alone for its own purpose. Like for example, protein is required for your tissue building, muscle building and all. If this protein is used up for energy, there is nothing left for tissue building and muscle building and everything. So that is why carbohydrates has a protein sparing action. It helps the protein to be spared, so that proteins can be used for its tissue building and bodybuilding activities, and energy requirement the carbohydrate will take care of it. Is it clear? Any other doubts? Can we move on to the next chapter 4, dietary fiber? So is the screen visible to all? Okay. So dietary fiber, as in the first slide of carbohydrates, I mentioned the word hydrolyzed. Okay, hydrolyzed means a one molecule of water is able to break down the complex compounds or more bonds in carbohydrates, protein, or anything. Okay, so water is able to hydrolyze. Lyze means to cut, to break. Okay, hydro means related to water. So water is able to cut. In dietary fiber, water molecules cannot cut their complex bond. That's a difference. Dietary fiber is a type of carbohydrate, but hydrolysis will not act on it. And most of the digestive enzymes which your body produces, even those enzymes cannot easily break it. Okay, cannot easily break the dietary fibers. So it's a bit of a difficult kind of carbohydrates, but it is required in your diet for the various functions which we will discuss. So that's the difference between dietary fiber and it is basically a carbohydrate, but how the dietary fiber differs from other carbohydrate is sources of carbohydrates like the free sugars, the oligosaccharides, starch, and everything. They undergo hydrolysis. They act with the digestive enzymes. Okay, we have seen how um, lactose is broken down into glucose and galactose. Okay, dietary fiber will does not act in that way. Even water molecules cannot break its bond. So how it is required, how important for dietary fiber is in the diet, and also access of dietary fiber, what it will lead to. Okay, so that we will discuss. So that is the main thing which you have to remember. Some important tables and page number or paragraphs which I may uh, especially specify here, please mark that. So dietary fiber is found in whole grain cereals, fruits, and vegetables. Fiber is made up of indigestible parts or compounds of plants which pass relatively unchanged through our stomach and intestines, because our enzymes or water cannot change its bondage, cannot break it, cannot make any chemical change in this fiber. So usually when we excrete it, usually it is in the form how we have ingested it. It cannot be relatively unchanged. It's not that it will be exactly the same, but it is relatively unchanged. Fiber is mainly a carbohydrate. So the main role of fiber is to keep the digestive system healthy. For your gut health, it's very important. So you can take a screenshot of this screen. There is a table in page number 4.1. So that entire table is just put in one classification format here in the screen. If you want to take a screenshot of this particular screen, please do take it. So dietary fiber, we classify them into soluble and insoluble dietary fibers. Okay, so soluble dietary fibers, they are fermentable. Fermentable means they can give you some source of energy, not much, but a very negligible kind of way, but they can energy can be an end product after digesting them. In insoluble dietary fibers, they are not fermentable. Okay, they will not give you any source of energy. Okay, but they have other functions. Sometimes some of these will act as prebiotics also in your gut. So they have their own other use, importance in your body. So under fermentable or soluble dietary fibers, many examples are given, but in your textbook we are discussing only about pectins and gum. In the table only about pectins and gum they have given, so you can forget about all these other names. If you are interested, if you took the screenshot, you want to learn more, you can definitely learn more through internet about these molecules. But in textbook only pectins and gum is given. under the soluble fibers. Okay. In insoluble fibers, we have cellulose, hemicellulose, lignin, and resistant starch, resistant protein. Resistant starch and protein is not given in the textbook. Only these three, the first three are given: cellulose, hemicellulose, and lignin. Just read about it, how it helps. For example, cellulose will help in the cell wall constitution. It will make sure your cells, each cells have a very integral and structurally integral cell wall. Hemicellulose will make sure there are certain secretions from the cell wall that takes place normally. Lignin will make sure lignin is the woody part of the plants, and it will not be digested, so it will be completely discarded from the body. Just read about pectin, gum, cellulose, hemicellulose, and lignin, which is given. Just remember the names, the contents, you can understand it. Now we will see the physiological and metabolic effects. Effect on nutrient, how the dietary fibers will affect the nutrient absorption, digestion, and all. So in nutrient absorption, they cause a delay, because what happens is, as I told earlier, when you have a lot of dietary fiber, they cover up the nutrient along with the food in such a way that digestive enzymes are not able to reach the nutrient, act on that, break down the nutrient, and make it ready for absorption. Okay, so it delays the nutrient absorption. Anything which is mixed up with the dietary fiber, it slows down the digestion and absorption. If absorption is slowed down or if it is delayed, most of the nutrient will be excreted out of the body instead of getting absorbed. Barrier to digestion, as told earlier, the structure of this fiber which envelopes the entire nutrient. Nutrient is inside, the dietary fiber will be mixed with it, envelops the nutrient. It remains intact, and it slows down the whole process of digestion. So it actually acts as a physical barrier between the nutrient and the digestive enzyme. Even if you're having whole grain, okay, whole grain means outside it is fiber, inside is a nutrient and everything. Okay, so if you have in just a whole grain as it is very difficult for your digestive enzyme to break through the fiber coating of the whole grain, reach the inside of the whole grain for the minerals and carbohydrates. It is very difficult. So usually whenever you have a whole grain, it is excreted as it is out of your body. So that's the effect digestive fiber has on digestion. It is a barrier to digestion. Nutrient binding, many cell wall polysaccharides and lignins interact with the metal ions absorption, like iron, calcium, zinc. Okay, what happens here is some kind of nutrient fibers, some types of nutrient dietary fibers, it will bind with the minerals which is found in the food in such a way that the body will not be able to absorb these minerals. Especially, it has this effect on calcium, zinc, and iron. So this is the reason it can result in the conversion of soluble minerals into unabsorbable forms. The soluble minerals means it is easier for your human to absorb the soluble mineral because of osmotic pressures and concentration. It will be easier for the small intestine to absorb the soluble minerals. But now it is mixed up with dietary fibers. It becomes unabsorbable and it will be completely excreted by the body. So this is how these are usually, if you see in a bird's eye view, most of these effects are undesirable for the optimum health of the body. That is why we have a limit to which dietary fiber should be limited. More than that, we will read about that in the recommended RDA for dietary fibers. Okay, excess of dietary fibers will put a person into a state of deficiency in various categories, especially in minerals and all. So that has to be taken care of. Then we will then the next function here is water holding capacity and viscosity. So there are certain water soluble fibers like pectins, gums, hemicellulose. They have a high water holding capacity. Okay, and if something has a high water holding capacity, it becomes gel like, it becomes very viscous. Okay, slow moving viscous. I guess you understand what is the meaning of viscous. If you have a doubt, please do Google it. The meaning of viscosity and viscous. Okay, it becomes gel-like. Okay, it's a thick fluid. So, what happens with the water holding function of dietary fibers? Delayed gastric emptying. You must have seen that when you have a meal which is rich in dietary fiber, okay, a lot of fruits, vegetables, or you had whole grain chapatis or something like that, not refined one. Okay, in after having that, you will feel you are very full. Okay, you feel satiated for a very long time. You don't feel hungry for a very long time. Why? Because it's so difficult for the dietary digestive enzymes to penetrate into this dietary fiber and to break them down to get the nutrients out. It is so difficult that the entire bolus of food will stay in the stomach for a very long time, getting mixed up with the gastric juices over and over again. So it leads to delayed gastric emptying. Okay, gastric emptying means leaving the food contents, the undigested food leaving the stomach. Okay, so the food will stay in the stomach for a very long time. Reduced mixing and enzyme function, as said earlier, because it's a very viscous in nature. It's very thick fluid and viscous in nature. It's really difficult for the enzymes to get mixed with it and to start the digestion and metabolism process, and or making the nutrients ready for absorption. It's very difficult for the enzymes to do that. Then we have decreased diffusion rate. Diffusion rate means from high concentration to low concentration, the nutrients has to pass while they are passing through the small intestine. So since the nutrients is completely covered with the dietary fibers, the nutrients are inside the viscosity of the dietary fibers. They do not have enough time to get absorbed by the small intestine. So decreased diffusion rate, they will be passing along with the small intestine very soon, and it will be completely excreted. Then we have altered small intestine time. What happens here is the soluble fibers with decreased diffusion rates will increase the transit time. Maybe, for example, things that have took a lot of time staying in the stomach, when they reach the small intestine, they will be passing through the small intestine very quickly. Remember that, okay? Fiber rich food which took a lot of time staying up in the stomach, as soon as they reach the intestine, they will be removed out quickly. Okay, so that is the usually, for example, if the food has to move through small intestine and large intestine within 2 to 3 hours, if the food was rich in dietary fibers, it may stay in the stomach for 1 hour or more. But as soon as it reaches the small intestine, within 1 hour, or within the normal duration, less than the normal duration, it will be excreted. So it leads to fecal bulkness, a lot of fecal matter being excreted. Next, we have adsorption. Adsorption means adhesiveness, sticking onto. Okay, at the adsorption and binding capacity of dietary fiber. So again, like lignans, gums, pectins, hemicellulose, they have the ability to bind to substances such as enzymes and nutrients in the gastrointestinal tract, in your stomach, and even in the small intestine and all. So they have this sticking kind of characteristic. So what happens here is these fibers will stick to the nutrients, yeah, and even to the enzymes, and it will change the pH level of your gastric inside of the pH level of the gastric juices, or the gastric lining and all, the pH level will be altered. And also depending upon the size of the bolus which is coming out, uh, how the food was processed. Is it too much fried kind of food, or was it a uh, easily processed food, or heavily processed food? Depending on that, depending on various factors, okay, the absorption and the binding capacity of these fibers may change. Okay, so diminished absorption of lipids. So when these dietary fibers get mixed with fats, okay, when you have food rich in fat, but you also have a lot of fibers, it will stick to the fat in such a way that it will make sure that the fat, the lipids are not absorbed by the small intestine. It will make sure the excess amount of fat is being excreted from the small intestine. So that is how the stickiness of the dietary fiber will make sure that excess of fat is not absorbed. So it will usually help. It will reduce the blood. If the person who is looking for weight control or looking for reducing the blood cholesterol level, in such case, having a good dietary fiber rich food will help you out. Okay, it will make sure even if you're having fatty food, along with the dietary fiber rich food, it will make sure that excess of the lipids are excreted out. It is not absorbed by the intestines. Then we have increased fecal bile acid secretion. So when the gastric when you are having dietary fibers, a lot of time is taken up in the stomach itself. So what happens is that a lot of bile juices are being secreted by the liver and all. So when a lot of bile is secreted, the lot of bile will also be excreted from the intestine, because it was not able to function along with the dietary fibers. So that is how increased fecal bile acid secretion. Because when the gastric emptying was delayed, a lot of bile was being secreted to help the gastric juices aid in the digestion. But since it is a dietary fiber, it is very difficult. It will be secreted. Okay, so that is increased secretion of bile as well as excretion of bile. Lowered serum cholesterol, as I have explained earlier, with a lot of excretion of bile acids in the feces, along with the lipids which has been stuck with the dietary fibers, it has been excreted by the body. With that, your serum cholesterol level will reduce. Then altered mineral balance. As I told earlier, there are few dietary fibers which will help in mineral absorption, but most of them, they hinder the mineral absorption. So the overall effect that the fiber has on mineral balance depends to some extent on its degree of fermentability. For example, if you're having dietary fibers which are fermentable, it will aid in the mineral absorption. But if you are having a lot of unfermentable dietary fibers, it will not help in mineral absorption. Some examples are given here. If you are having fermentable fibers such as pectins, they are favorable. They have a favorable effect in mineral balance. Calcium, zinc, and iron are bound to these fibers, pectin form of fibers, and as soon as the fermentation of the pectin takes place, these minerals will be released and they will be absorbed by the small intestine. So you can read that under that particular section. Then degradability or fermentability. Fermentable fibers, pectins, gums, oat, wheat bran, psyllium, these all are the fermentable fibers. Some examples are given. So yeah, increased water and sodium absorption, I have not mentioned in the slide, but that was missed here. So this short chain fermentable fibers will help in increased water and sodium absorption in the colon. The short chain fatty acids produced by fermentation are rapidly absorbed and their absorption in turn simulates the water and sodium absorption in the colon. Then mucosal cell proliferation in your small intestine and all. There are cells which secretes mucus, okay, so that it aids in the peristaltic movement and all. The increased amount of mucosal cell means a lot of mucus is being secreted. If a lot of mucus is being secreted in your small intestine, it will make sure that you do not suffer from constipation a lot. Okay? Constipation stays away in this case. So fermentable fibers helps in production of a lot of mucosal cell. Okay, so thus it helps in preventing constipation. Next, we have provision of energy. It's not the most important criteria, but very few fermentable fibers can give few amount of energy, not much, when the fermentation takes place. So as a byproduct of that, carbohydrates and energies are being released. Acidification of the luminal environment. Luminal environment means inside your GI tract, basically inside the interior of the GI tract. The pH value will be less. If you know what is the pH value, the less number of pH value means it is acidic. The more the pH value means it is basic. So fermentable fibers ensures that the pH of the luminal environment, that is your GI tract, remains acidic. So that is favorable for digestion. Now non-fermentable fibers. The first is detoxification. So what happens here is, when you have a non-fermentable fiber when it is insoluble, okay, it makes sure that a lot of microbial cells are produced because they act as a prebiotic. Okay, when they act as a prebiotic, lot of probiotic bacteria, good bacteria in your gut will proliferate, will uh, will multiply. When good bacteria multiplies, they scavenge away, means they eat away all the cancer causing cells or other toxins which may put the gut health into risk. Okay, all such external factors or anything that is going out of the control, it will be scavenged away, it will be eaten away by this good bacteria, and it will be excreted through the feces. So that's how non-fermentable fibers helps in detoxification. Then you have increased fecal volume, as told earlier. When there is a delayed gastric emptying, when this chyme enters the chyme means food that is undigested food that is mixed with a lot of gastric juices. So when this chyme enters the small intestine, it will not take much time to pass through the intestines. So a lot of fecal matter will be there. There will be increased in the fecal bulk. So those were the effects, how dietary fibers will affect the different areas of the gut health as well as the GI tract, and also how it enhances as well as reduces the absorption of various nutrients and minerals. So role in preventing diseases, coronary heart disease. Can anyone say how dietary fiber will reduce coronary heart disease? In the chat box, if you had listened through the class. 2 to 3 times I had mentioned somewhere. Yeah, eliminates serum cholesterol. True, right. So that is how this dietary fiber will help in reducing the risk of coronary heart diseases. Diabetes mellitus. Anyone? How dietary fiber will help in the lifestyle of patients suffering from diabetes mellitus? In the chat box. Yeah, it slows down the release of sugar into the blood because there is a delayed gastric emptying. Whatever food you have, which is rich in dietary fiber, it will stay in your stomach for a lot of time. Okay, so as long if a food stays in your stomach for a long amount of time, it will be absorbed slowly, it will be broken down slowly. Okay, everything whatever comes after that, it will be very slow in such a way that the blood glucose level will also be increasing slowly. There will be no sudden spike in the blood glucose level. So that is harmful for the people who are suffering from diabetes mellitus, DM. Delay in glucose absorption. Yes, true. Constipation and diverticula. Diverticula means, just imagine this is a segment, a small segment of your bowel, okay, of a intestine, just a small segment of your intestine. There is an outpouching. Okay, this is a normal intestine, how it should be. Waves are there, but a small segment, just take it as a straight line, parallel line. Okay, where there is an outpouching on either side or any one of the side, that is what we call as diverticulum. Okay, so what happens is when the fecal matter is moving through the intestine, it gets stuck in the outpouch and sometimes staying there for a whole lot of time. It will lead to infection and other irritable bowel syndrome. It will lead to further complications. So that is diverticulum. So anyone can you briefly say how dietary fiber will help in people who suffer from constipation and diverticular? A small paper image of diverticulum is given in the textbook. Those who have not understood, please see the image, at least you will get an idea. So anyone? If you have understood the physiological and metabolic effect area, it is very easier for you to answer the questions here. Increases bulkiness of fecal matter. Yes, also one more thing, I don't know if it is there in the textbook or not. As I have said earlier, mucosal cells will increase. It will help in the increase of mucosal cells. When the mucosal cells are more, lot of mucus is being secreted into the lumen. This mucus will make sure that constipation stays away. Okay. Colon cancer. The last physiological effect which we discussed, will show how it will help in colon cancer. Anyone in the chat? I don't want answers from the points which is given. Just use your own words and also from your understanding of the physiological effects. Yeah, it helps the good bacteria in eating away the cancer causing cells and toxins. Yes. And weight control, I guess everyone knows how it works. It keeps you satiated for a very long time, so you will not be snacking here and around. You will have a fixed meal, and also it will make sure that if you have a fat rich food along with the dietary fiber, most of the fat will not be absorbed, it will be excreted because the fiber will stick with the fat and other nutrients and all. So it reduces the absorption of nutrients and minerals, and in that way weight control is achieved. It also aids in the metabolism. Yes. So RDA for fiber. One thing which you have to remember here, RDA, you can read ICMR RDA is given in table 4.4 in page number 59. So you can go through that when you are giving a consultation to a client. You can go through this table. You do not have to learn by heart these things. The only thing which which is important from examination point of view, I have mentioned in the screen here. Over 60 gram of fiber can reduce the nutrient absorption. So your recommended dietary allowance for everyone should be below 60 gram. That is understood. And at what percentage, at what age and all, that you can refer the table for your consultation. But the thing that is important here is, do not recommend more than 60 gram of fiber to anyone, because that will reduce the nutrient absorption. So table 4.4, page 59. Please go through that for your consultation or for your practical purposes. Then we have sources of fiber, that is table 4.5 in page number 60. We can go through that again for consultation purpose and just understanding and